warning, Malaysian and even worldwide have been very concerned and open up about our mental health being. I'm Dr. Sarah, a clinical psychologist, and you're watching Know the Anxiety. And yes, for sure, we were talking about the symptoms of anxiety, how our body responds to it, and the treatment itself. But more specifically to a social anxiety disorder, where it is the fear or anxiety in situations that include evaluation of others and you try to avoid social situations. Imagine you are getting ready to a party, you feel very nervous and you get this upsetting feeling in your stomach. You feel that something holding you back. You are afraid to get close to people, you feel very anxious, you feel very uneasy, and you are afraid that people might judge you. And you start to wonder, what if no one wants to talk to me? What if they feel I'm weird? And what if they think my outfit are ugly? Anxiety can lead to depression, school dropout, and even suicide. It can cause significant breakdown in one's life. But a lot of people don't know about this, and they sweep their anxiety under the rug as a way to get over it, and they feel that it is a weakness, where it is so much more than that. So, to a better understanding, here's some clip of a session between Dr. Iman, one of our clinical psychologists that specializes in anxiety and depression, with her client, Miss Aziza, that deals with social anxiety disorder.
Hello, I'm Dr. Iman, a clinical psychologist specialized in anxiety and depression. Today, we will be talking about the symptoms and signs of social anxiety, which is characterized by intense fear of being negatively judged by others. Aziza, one of my clients, will be share her experience dealing with social anxiety. Okay, welcome, Aziza.
Hi, I'm Aziza. Right now, I'm a university student. I feel anxious and nervous when I talk or making presentation in my class. I always try to avoid this situation. I feel like my classmates are making fun of me. They making fun of the way I talk or how I dress myself. The worst is I have difficulty interacting with lecturers or other authority figure. Sometimes I feel nervous when interacting with other people and almost always try to avoid to deal with them. I'm afraid that I will do something that humiliate or embarrass myself in a social situation. I even feel anxious and nervous drinking or eating in public. Even thinking about that really makes me uncomfortable. I will rather stay in my room and doing my own thing instead of going out.
Alright, thank you Aziza for sharing your experience. According to what Aziza has shared, she may have social anxiety disorder. If you experience dread when carrying out a daily life activity such as speaking on the phone, starting conversation, or meeting new people, you may have suffered from social anxiety disorder. So people who have social anxiety disorder may fear criticism, they tend to avoid eye contact or have a very low self-esteem. You may also worry about doing something you think it is embarrassing. So physical symptoms such as blushing, sweating, or appearing incompetent may appear. As Aziza also mentioned, with social anxiety, it may be difficult for her to do things when others watching, as many people with social anxiety also will experiencing other symptoms such as nausea, trembling, panic attack, or a pounding heartbeat. So yeah, that's all for today's meeting on sign and symptom of anxiety. Thank you, Aziza, for your perspective, be patient.
And so, from the slide given, it is understandable that our body will give response to any circumstances that experienced by people dealing with anxiety, such as emotional state that shifting to negative side, because any situation will be taken negatively by people experience anxiety. And also, of course, it will increase their heart rate as their body and their heart need more oxygen and blood supply. And they will feel rapid breathing and even dizziness as too much oxygen in their body due to the rapid breathing itself. And the pain in the chest as their muscle will feel tense for the preparation of danger. And they also will feel stomach ache and sweating as a way to cool down their temperature, their body temperature. So that is the way of our body responds to anxiety itself. It can be unpleasant, but of course, it is a way of survival system that built by our body. Well, as bad as your day may seem to be, it can be treated. Let's hear Dr. Iman's explanation for the treatment needed for people dealing with anxiety.
Treating anxiety disorder is like many other mental illness that may involve psychotherapy or medication or the combination of both treatment. If it's psychotherapy, cognitive behavior therapy has been effective since it teaches the patient to behave in different way and react differently to the situation that would usually cause anxiety and worry. Medication like benzodiazepine or antidepressants might be prescribed as well. Benzodiazepine are a type of psychoactive drug that have a relaxing and calming effect. Antidepressants might also be prescribed like selective serotonin reuptake inhibitor or SSRI, which regulate the serotonin level in the brain and help elevate mood.
Living with anxiety illness can be difficult and unpleasant. Constant stress and fear can leave you exhausted and terrified. Talking to your doctor about your symptom of anxiety is the first step in letting go of your anxiety. Finding the correct treatment for yourself may take a while, may take some time. If you have several anxiety disorder, you may require multiple types of treatments. Most persons with anxiety disorder benefit from a combination of medication and the treatment of psychotherapy or even the therapy itself. You can learn to control your symptoms and thrive with the right care and therapy. That's all from me and my team here. Thank you.